For the first time, researchers have strong evidence linking diet to slowing cancer growth. The new study comes from Johns Hopkins Medicine. It shows that a healthy diet can help prevent low-grade prostate cancer from progressing into a more aggressive form. More detailed results revealed that a high-quality diet reduced the risk of progression in these patients by 15 to 30% over 6.5 years. Rather than making unsubstantiated claims about what constitutes a good or bad diet, this video will explore this latest research. Using these evidence-based results, we will explain what a high-quality diet includes and how you can incorporate it into your anti-prostate cancer lifestyle. Make sure you watch until the end to get all the useful information. For men diagnosed with low-grade prostate cancer, particularly those with grade group 1 GG1, active surveillance is a thoughtful, non-invasive treatment approach. Rather than immediately pursuing aggressive treatments like surgery or radiation, active surveillance involves closely monitoring the cancer's behavior over time to avoid unnecessary intervention, while ensuring timely action if the disease progresses. This method is especially suitable for older patients or those with comorbidities where the risks of treatment might outweigh the benefits. During active surveillance, many patients are interested in changes they can make to reduce the risk of their tumor becoming more aggressive. The role of diet and nutrition is naturally one of the most commonly asked questions. This prospective cohort study included 886 men diagnosed with grade group 1 prostate cancer from January 2005 to February 2017. Of these participants, 55, 6.2%, were Black, 803, 90.6%, were white, and 28, 3.2%, identified as other ethnicities and races. All of these patients were in the Johns Hopkins Medicine Active Surveillance Program. At the time of enrollment, they completed a validated food frequency questionnaire regarding their usual dietary patterns. Data were analyzed from October 29, 2023 to June 17, 2024. Prostate cancer's grade groups range from 1 to 5, with higher grades indicating more aggressive behavior. It is determined through a prostate biopsy. Grade group 1 indicates indolent cancer cells that don't look very different than normal tissue and do not metastasize. At the other end of the scale, grade group 5 indicates cancer cells that appear quite abnormal and can grow and spread throughout the body if untreated. These grade groups are how clinicians classify the cancer's biological aggressiveness. During active surveillance, biopsies are performed at regular intervals to check for changes in the prostate cancer that would reclassify it as a higher grade group. This process is known as grade reclassification. Reclassification often leads to a recommendation for treatment. It is also a common way to evaluate the effectiveness of therapies and lifestyle modifications. The results were obtained by analyzing the relationship between the reclassification rate and two index scores, including the Healthy Eating Index, HEI, and the Energy-Adjusted Healthy Eating Index, HEI. The HEI ranges from 0 to 100. The HEI takes a person's daily caloric intake into account. High HEI and HEI scores indicate a high-quality diet. At the follow-up assessment at 6.5 years after diagnosis, 187, 21%, men had been reclassified as grade group 2 or higher, of whom 55, 6%, had extreme grade reclassification to grade group 3 or higher. The researchers found that the higher the HEI and EHEI scores, the lower the risk of low-grade prostate cancer progressing to a higher-grade cancer requiring curative treatment. Among patients adhering to a high-quality diet, every 12.5-point increase in the HEI score was associated with an approximately 15% reduction in reclassification to grade group 2 or higher, and a 30% reduction in reclassification to grade group 3 or higher. In addition to these two metrics, the researchers calculated scores for each study participant using both the Dietary Inflammatory Index, DII, and the Energy-Adjusted Dietary Inflammatory Index, EDII. However, they did not find an association between grade reclassification and DII or EDII scores. The researchers believe that this lack of association with DII and EDII may indicate that inflammation plays a role in the progression from healthy prostate to one with cancer. However, in men who already have prostate cancer, the more subtle biological change from lower to higher grade may reflect other mechanisms potentially influenced by diet. Thanks to this groundbreaking new study, the connection between a high-quality diet, reflected by elevated healthy eating index, HEI, and energy-adjusted HEI scores, and a significant reduction in prostate cancer progression has been clarified. Specifically, the research indicates that a 12.5-point increase in HEI scores is associated with a 15% to 30% lower risk of reclassification to a higher grade group among men under active surveillance, offering a promising avenue for managing low-grade prostate cancer. Naturally, you might be curious about the specific foods and dietary patterns that can boost these scores. Here is what you can do. To improve HEI, focus on nutrient-rich options, including fruits like berries and citrus, vegetables such as leafy greens and cruciferous varieties like broccoli, whole grains like quinoa and brown rice, lean proteins such as fish and legumes, and healthy fats from olive oil and nuts like walnuts, while cutting back on processed foods, sugary drinks, and high-sodium items. For HEI, prioritize nutrient-dense, low-calorie choices like vegetables, fruits, and whole grains, carefully managing overall calorie intake and avoiding calorie-dense, nutrient-poor foods like fast food and sweets. To enhance the dietary inflammatory index, DII, incorporate anti-inflammatory foods such as fatty fish rich in omega-3s like salmon, turmeric, ginger, green tea, and berries, while reducing pro-inflammatory culprits like red meat, processed foods, and trans fats. Similarly, for the energy-adjusted DII-EDII, emphasize energy-efficient anti-inflammatory options like leafy greens and nuts, and minimize high-calorie inflammatory sources such as fried foods and sugary snacks. These evidence-based dietary adjustments can play a crucial role in optimizing health outcomes, though consulting a healthcare provider for personalized guidance is always recommended. A diet optimizing all four indices aligns with a Mediterranean-style approach: abundant fruits, vegetables, whole grains, legumes, nuts, and olive oil, moderate fish and poultry, limited red meat, processed foods and sweets, and minimal alcohol. This balances nutrient density and reduces inflammation. Portion control and regular physical activity further enhance these benefits. However, the lack of DII and EDII association with reclassification in the study suggests inflammation might not be the sole factor, warranting caution against overemphasizing anti-inflammatory diets alone. Consult a healthcare provider for personalized guidance. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.